Hi, everyone. I'm going to give you another update, my usual weekly updates on what's going on with COVID-19 in the East Ontario Health Unit region. I'm just going to share my screen right now to give you overview of where we are locally and provincially. And so you can see here that our hospitalizations are slightly up, no ICU admissions, and we have a bit of an increase in our outbreaks, and our positivity is a bit lower than the provincial average. I'm just going to give you some more details here. So in terms of the next slide here, you can see our positivity rate has up and down, although the daily was 10.9, sort of the weekly average is about 12 to 13 here. Again, it's been stable now since it's been about the last month or so. Just to compare what we had in February, we were 30% plus, and so that is a better thing. It's still going up and down. It's not going down, but we're leveling off, which is a good thing. If we're looking at our hospitalizations right now, you can see again we had a very marked decrease moving forward, and then a slight increase now over the last week or so that we're seeing a trend upwards again. However, the good news is no ICU admissions related to COVID-19. Again, we're seeing the same. We had a big increase in our outbreaks in the January, February. They went down, and now again you can see they sort of went down, and now they're hovering around 4 or 5. So again, these are all showing trends that we are having increased community transmission, and this is actually seen provincially as well. The other, just to sort of show you, speaking of the province, here we are basically looking at most of the health units have experienced some slight increases in cases, including ours, but very slight. It's not a big increase, but you can see, and then some of the health units are going downwards. But again, we're kind of leveling off in terms of our numbers. If we look at provincial picture again, we were over 300. We're down to 75 here, so you can see it's going down. But there is a variability across the province, and so we're keeping an eye on that as well. In terms of our wastewater, one of the things that we're seeing again, this is the peak that we had of wastewater. In the blue is Cornwall, orange is Hawkesbury, and gray is Castleman. And you can see we've had sort of some ups and downs, but over the last week or so, we've kind of leveled off. So that's good as well. We're seeing some signs of increase, but some signs of stabilization, and certainly not to the overwhelming numbers that we saw here. And that's what we're seeing provincially, either leveling off or slightly increase. Now, when it comes to vaccinations, again, this is where we're sort of stuck. We're still just almost at 60% of third doses, and we'll talk to you about the importance of getting the third dose. You could see that the green here still shows work to do when it comes to increasing, particularly 50 and over, third dose vaccination, because that's going to be really an important protection, as you'll see later on. And then still we're stuck at the 51% mark for the 5 to 11s, and although we had a good uptake for the first 2 doses for the 12 to 17, we're still at low there, and so we've got work to do as well across all ages. But again, this is something that I'm going to review later. But speaking of vaccines, again, I showed this last week, but I can't. It's important to repeat. If you look at this slide here, it shows you against Omicron infection, be it the B2 or the previous version that we had. You could see that you do get a bit of an antibody rise. This is the protection, taking the blood tests after people have got their dose. So you could see that the protection increases 1 month after, and then kind of decreases a bit 7 months after 7 months after the second dose. But you could see the third dose boosts really high, almost double the initial dose, and stays at a much higher rate 6 months later. So that's why this is very important, because that will offer much better protection if you get a third dose. And again, we're only at 59.7%, barely 60% in our area. In Ontario, it's in the 50 plus range. So we need to increase that, particularly among people who are vulnerable, particularly people who are 50 and over or have underlying medical conditions. And that's, to me, very, very important. Also, to say that again, when we're looking at cases, when you're looking at hospitalizations, when you're looking at deaths or ICU admissions, all of these in red here are the ones that have had 1 or no doses. And you could see that for any situation, be it cases, hospitalizations, deaths, or ICU admissions, far outnumber the non-vaccinated or partially vaccinated, far outnumber the fully vaccinated. You could see that across the board. So yes, although they may not, the vaccines may not prevent infection 100%, they certainly prevent severe disease and hospitalization. And that's what we're counting on. That's why we need to boost up those third doses. And I'll talk a bit later, we're going to brace ourselves for fourth doses. Now, I just want to give you a bit of some latest modeling that we had this morning. The science table and I shared this with you last week, showed us that there would be, based on removal of masking, based on removal of all the restrictions, there would be an increase in cases. And you could see here that in terms of hospitalizations, they expected about 1,000 or so cases if it's a moderate increase, and about 200 to 300, a couple of hundred of ICU admissions as well, based on that. Now because the uptick is a bit higher, it seems that the numbers are going up a bit quicker in certain parts of the province. We're looking at potentially 2,000 admissions, so somewhere here, which is half what we were in January, February, and about 400 ICU admissions again, which is less than half of what we were in February, and that's the worst case scenario. And so what we want to do is we end up with the best case scenario, and so it's very important for us as we move forward to react to this data and say, like, sort of at the local level, I can tell you that we're seeing a small surge in the Omicron, but the B2 version, which is a bit more transmissible, but fortunately it doesn't cause more severe disease and is prevented just the same way that we would prevent the previous version. And so the very important thing, so we want to decrease those numbers, keep everything open, not have to go back to restrictions, which nobody wants. We really need to, again, I'm asking you, please get your third dose if you haven't got it yet. If you haven't been vaccinated at all, get your first or second dose. If you don't want the mRNA vaccine, now we have a Novavax vaccine, which is like a typical previous version vaccines that we've been using for years. That would be available to you as well. So in any case, whatever it is, please get vaccinated, get your first, get your second. And importantly, we have a high percentage of people who have got their second dose. We're almost 90% of 12 plus. Those individuals, if you get your third dose, if you still haven't got it yet, please go and do so. It's available everywhere. That will help us prevent future shutdowns. It'll help us maintain our healthcare system and prevent the vulnerable. So what we want to do, yes, we're now in a bit of a surge. People call it wave 6. I just call it a surge. It's going to be sort of up and down. And this is what we expected. I want people to understand this is not a surprise to us. It's a bit of a surprise because the B2 Omicron variant is a bit more transmissible, but we did expect that when we removed the restrictions. But however, we do have things that we can do right now. So number one, get vaccinated and boosted against COVID-19, and stay tuned. There will be announcements over the next coming weeks. Fourth dose for likely individuals who are elderly or have chronic medical conditions, and likely a fifth dose for those in long-term care settings. So we're working with the ministry. We're getting ready to have plans to be able to get that going as soon as it's available. Because again, we know that in the elderly, the third dose, although in most people will last 6 months, in the elderly it may wear off a bit earlier, and so that's why we want to give the extra dose. That's very important, and I think that one of the things that we're also doing as well is we also have antiviral medications, and basically that's going to be something that we're going to be, stay tuned for that as well. It's going to be called test to treat strategy. So we have a list of individuals that may be vulnerable to complications of COVID. And so what we're trying to do is, again, to keep them out of hospital, we're going to be having this test to treat. So there'll be communication, stay tuned for that, where you can, if you're an elderly individual or have certain medical conditions, that you can go and get tested and get treated right away with either oral medication or an IV infusion that will prevent severe disease in 85-90% of the cases, depending on where you do it, and if you treat it early enough. So that, stay tuned for that. I'm going to be talking about that a lot, because I do believe that will be the key to being able to prevent the vulnerable and elderly from getting sick and being hospitalized and dying. One of the things that I'm seeing is, despite the fact that well, the good news is that despite the fact that we're seeing some cases go up over the last couple of weeks, the death rate has gone down, which is good news as well. And we want to continue that. We don't want to see any more deaths. We want to make sure that we offer those vulnerable individuals the antivirals. And again, we know that in those vulnerable individuals, particularly for immunosuppressed transplant, the vaccines, even if you give them 4 doses, they won't work as well as in other individuals. So that's why we need to have those. So stay tuned for that. It's going to be called the test and treat, where if you have symptoms, you can go to a variety of places. We'll be able to tell you, get tested and get your pills or get your IV treatment, a day or 2, depending on an outpatient or whatever. And we do now have antiviral medications that we can give once an individual is if an individual is hospitalized to prevent severe disease. So these are all good things that we're having, and that's what will allow us to be able to move forward and live with COVID. The other thing that we need to be doing is wearing a mask. I think it's very important. Although the mandate is gone, the recommendation is still there. Wear a mask when required and based on your individual risk or situation. If you're a vulnerable individual, elderly individual, and you're going out to crowded places, or if you feel uncomfortable, if you're in a crowded indoor place, wear the mask. And this I will be recommending for the next 4 to 6 weeks because we're still going to be indoors, and that's the time it's going to take for this next little sort of uptick in that wave of B2 to go away. So that's why we're talking about that. We'll reevaluate that. I do believe that summer will be better, but for the short term, please continue wearing those masks, please. That's very important. And obviously continue using the usual public health measures, washing your hands, don't going out when you're sick, and so on, cough and sneeze into your sleeve. All these things are very important moving forward. Thank you, and I'll talk to you next week.